Ladies and gentlemen, a very good morning live from the Swiss Pavilion at Expo 2020. It's a pleasure to greet all of our guests who made it here at the Swiss Pavilion, but also all of our guests who are joining us live. And we are very happy for you to join us. My name is Dante Larini. I am project manager for SwissNext at the Swiss Pavilion. SwissNext is an agency of the Swiss government to promote education, research and innovation abroad, and also connect them with the most innovative hotspots in the world, which includes the UAE, Dubai and Expo 2020, obviously. Today we are starting our third series on public health, where we are partnering with the Swiss School of Public Health, a coalition of 12 schools, 12 universities of Switzerland who are specialized in postgraduate public health topics. And today we are very happy to host the winners of the Next Generation Scientists, and we're very thrilled to host these students with us today. Science communication, as you know, is a key task for us to promote the research, promote the results of education for a broader audience. And this is something we're trying to do every day. And having such an initiative here at the Pavilion is a blessing. It makes us happy. It really enhances our mission here. So without further ado, I would just like to introduce the head of the Swiss School of Public Health, Professor Nino Künstli, to the floor. Thank you very much.
Well, good morning, everybody. Thank you very much, Dante, for the nice introduction. We are thrilled to be here in the Swiss Pavilion, and I can tell you, for those who are not here and don't see it, Dante is a wonderful host. It's incredible how he actually organizes even the audiences. We are very sorry that some 20 students from a local university were unable to join because of, life has been very complicated now everywhere in the world with the pandemic, but we do our best and we improvise, and I'm very pleased to be here. Also the technological team is fantastic in improvising, in finding always solutions. So it's my pleasure to open this Science Flash Talk highlight. Well, what is the Science Flash Talk? Well, as you have heard from Dante, the Swiss School of Public Health, we are actually a foundation, and we bring together the science faculty of public health sciences from 12 universities and all their teams and PhD students and researchers, in fact. And the Swiss School of Public Health has a very strong focus on training the PhD students all across Switzerland. So we have some 450 PhD students who are supervised by our faculties in the 12 universities. And one thing, we have a focus since several years. We started this prior to the pandemic, and the pandemic has shown us how important that actually is. We train the students also in communicating science, because we have now all understood it's crucial that we as scientists are actually able to tell people on the street what we are doing and why we are doing this and what the evidence is of what we are doing. So that needs also training, and I'm very, very happy that the young generation of the PhD students all across Switzerland, and those PhD students actually are from all over the world. I have to tell you, far more than half of them come from everywhere on the globe to study, to do their PhD in Switzerland. And I'm very happy to see their enthusiasm and interest in also getting this training of science communication. So we have organized courses since several years, with a wonderful company who is specialized actually in training the young people, and they do these workshops through several weeks where they learn how to communicate their science. And this year we have adapted it a bit, of course, with Corona. As you can imagine, one has to change a little bit the model, and also because we are guests here in the Swiss Pavilion this year. So this year the training was organized in the following way. We had some 21 students who could apply to the course. They were trained online and on-site in Switzerland in creating what you will soon see. And then we have exposed these video clips where they tell what they do in their science to a jury, and not a science jury, but really journalists, people who are actually trained also in communication, etc. Just not ourselves. So they have chosen the 8 best ones. And those 8 best videos, we have all put them online, and we have asked our community to vote who they would like most. Because, of course, we did not want to fly all the PhD students to Dubai just to compete here for the best, for the award. For obvious reasons, as you know, the Swiss School of Public Health is very much also trying to limit our footprint, and we are actually very, very few people here in Dubai, and all the events that we organize happen actually online. So we have the pleasure today now that we have 2 selected best ones selected by the community online, and those 2 are now supposed to compete for the very first award. However, we have Corona, and I can tell you we had again some changes in the program. It doesn't matter, we are very flexible. We have learned to improvise again and again, and the Science Flash Talk now is actually, we'll have the 2 winners so far who will compete, but actually one cannot even be here. Ogona Novanko, who is a PhD student at Swiss Tropical Public Health Institute in Basel, supervised by Kaspar Wyss. He is in Nigeria still. It was not possible to have him here, so we will show actually the video live, and then we will have the second competitor, and I'm very happy that Magda Gamba was able to do it, the trip. Magda Gamba is with us here, and she's a PhD candidate from the Institute of Social and Preventive Medicine of the University of Bern, actually supervised by Professor Oscar Franco. So these are the 2 selected ones out of the 21 video clips, which are all online, and you can actually watch them, and you can then see whether you still agree with what the decision will be today. So how we run that? First, we will show you the video of Ogona. Then I will invite Magda to live present her speech, 3 minutes. Yeah, this is a Science Flash Talk, science in 3 minutes. With Magda, we have the opportunity to challenge her with a few questions. Yeah, so this can be part of the story. And then we will open online. And here, I mean, we will open a QR code where you can vote which of the 2 you liked more. And of course, this is a little bit unfair. One is a video, and the other one is nervous and here. But we judge that you have a good judgment which one you just like more because of the content or whatever reason. Yeah. And that is the first part, and as you know, we have a second, a fantastic session, also a award-winning session actually at 11:30. Good, and that one will actually be moderated by Dr. Emily Reeves, who is our coordinator of the Swiss School at Public Health at the Expo here in Dubai. Yeah. Good, so let's do the following. I think you will now switch to the online mode and show the video, and I shut my mouth, and we will enjoy Ogona. Ogona Nwanko, as mentioned, he is now in Nigeria and not with us, unfortunately. Thank you.
Okay. Hi. My name is Dr. Ogona Nwanko. I'm a physician from Nigeria, and I'm currently a doctoral student with the University of Basel and the Swiss Tropical and Public Health Institute. How do we make the few available rural health workers less burdened by unnecessary paperwork? Dear faculty, I am here to convince you that the use of a simple, improved health information system can help to reduce the burden of healthcare workers by unnecessary paperwork. Just think about it. As a rural health worker, you've trained all your whole life for the moment when you start providing care, compassionate care to your patients and clients, only for you to start working and you find out that your day-to-day work is encumbered by you're trying to do a monthly summarization using unnecessary paperwork. This unnecessary paperwork is to summarize the kind of activities that go on but does not directly affect or impact on your day-to-day patient care. This, of course, can lead you to have less motivation, make your work more difficult, and this ultimately can impact negatively on the quality of care that you can provide to your patients on the day-to-day work. My PhD seeks to provide a solution to that. By the development of this simple, easy-to-use modified health information system, which allows you to use it on the day-to-day clinical care, as well as to be able to summarize the other information you needed from all those bulky old health information system. This has cues that also guides you in your day-to-day work. This simple tool seeks to improve or reduce the amount of time you spend doing unnecessary paperwork. My PhD simply seeks to demonstrate if this new health management information system can reduce the amount of time that healthcare workers in rural areas spend on unnecessary paperwork. This work is currently being carried out in 3 countries in Africa: Nigeria, Cote d'Ivoire, and Mozambique. Thank you.
So yes, thank you very much, Ogonna. I know Ogonna is at least trying to listen online. As you know, in some countries and in some times during the day, it's not always clear how good the connections are. We hope actually the connection here is very good today. So that was the video well prepared by Ogonna. It's my pleasure to now give the floor to Magda. I'm cleaning. And I give you the microphone. That's the plan. You don't have a microphone around you. No, please. Thank
you. Good morning, everybody. Hi, my name is Magda Gamba, and I am a doctoral student at the University of Bern, working on a healthy lifestyle. Eating, doing physical activity, smoking, and drinking alcohol are part of our everyday lives. Some of these behaviors are healthy, and some of them less so. Around 20 years ago, researchers used to study lifestyle behaviors and their associations with health and disease individually. But at the end of the 90s, someone created a score to study the impact of the interaction of multiple lifestyle behaviors as they happen in real life, not individually, but combined, because they happen simultaneously. And boom, suddenly the scientific literature was flooded with lifestyle scores to explore the relationship of combined lifestyle behaviors with health and disease. Against this backdrop, our research team wonders if the concepts, the behaviors, and the methods used to develop those scores are the most adequate. In many cases, we think they are not, as they are too heterogeneous. First, we scientists don't have a consensus on the concept of lifestyle. Second, there is no agreement on which behaviors should be included in those scores, as there is a wide variety of behaviors, and the methods used to identify, select, and operationalize those behaviors are so diverse. Finally, few scores have been validated in the literature, and validation is crucial in science, as it is required to apply the results of very specific research to general populations. All of this hampers and limits the conclusions and the comparability of the study's results on combined lifestyle behaviors and health. So, yes, this is a very heterogeneous field of research. However, this can be solved by providing a framework that allows permit that we can create or develop better scores in the future. First, by looking for an agreement on the concept of lifestyle. Second, by standardizing the methods used to select and to operationalize the behaviors included in those scores. And third, by developing a methodology that allows us to validate the scores in the scientific literature. So, ladies and gentlemen, the creation of this framework will be my contribution to health sciences at the end of my PhD. Thank you so much for your attention.
If we have a second microphone, we might open for a discussion, for questions, a few questions from the public. Who would like to raise the first question to Magda? Emily, did you want to start? I give you, yeah.
Magda, you mentioned that your main contribution. You mentioned that your main contribution for your PhD is to create this framework. Of those things that you mentioned to consider within your framework, what do you think is the most important consideration?
Thank you, Emily, for your question. Well, there are three key considerations, as I was mentioning before. The concept of lifestyle, and that's very challenging because understanding what lifestyle means, it's something that can be from different point of views. So we need to focus on what it means for health and for the research on health. And then when we manage to try to reach an agreement, we go to the behaviors, because the behaviors are the key of the scores. So we have here another critical point where we need to understand, are there actual behaviors we are using in research adequate? Should we think on other behaviors? We usually don't think, I mentioned diet, physical activity, but sleeping, exposing to sun are new behaviors that could also impact our health. So, and finally, the way I choose those behaviors, the way I present them in the score is also key. So I have to say this is, as the combined lifestyle scores I am researching, this is a combination of factors that work all together to try to, at the end, that we find or develop a better methodology to connect those three key points: concepts, behaviors, and methods, to develop the best one. So I cannot say there is one central question here, because all of them are important. Thank you.
Thank you very much for what we just have here. This it sounds like a great project coming on, but I think there are some challenges. The first one, as you mentioned, is in different cultures there will be different lifestyles. For example, there are some people who sleep early, some people who sleep night. So those lifestyles, how you again will make your framework work is taking in mind the different culture behaviors. Secondly, how you will motivate people to change, how you will motivate people that how it will be announced, like if you do this lifestyle is good or bad for your health, how you will motivate them. That's the second question. Thank you.
Thank you so much for your questions. And it's a pity for me today that the students are not present. I hope they are listening us or watching us through the live connection, because maybe I'm going to start from the last question you were making. How we motivate people to change is a very difficult thing. I know what it's supposed to be healthy, and even for me, it's very challenging to behave healthy every day. So I think we should start first with young people and really people who is watching us, you have the chance to start understanding this very early in life. So there are many behaviors, many things that we could do, but the only way we can manage to know them is through education. So it's part of a work of the children, of the young people, to try to know these behaviors, but it is also part of people teaching them in schools, in universities, which behaviors are those and how we can bring into our lives. And then it comes the first question, because for sure, I mean, we are today here, I'm from Colombia, but I live in Switzerland, and then just diet is something very different. And it's okay, this is something cultural that we need to respect. But still, we can have certain parameters that I can tell you, maybe it is important for you that you eat enough amount of fruits and vegetables, and then you can choose in your culture what are your favorite fruits and vegetables and eat them in an adequate amount. And I can go to Colombia and enjoy the wide variety we have there, but there is still a commonality in this sense. And the same for sleeping. We can go to sleep, like in Spain, people go to sleep, I don't know, very late at night, and then they wake up late the next day. And in Colombia, we start waking 5 o'clock in the morning. But still, we should try to keep a certain amount of sleep that is important for us as human beings physiologically. So there are certain commonalities that allow us to connect the behaviors despite the cultural differences. Thanks to you.
Magda, thank you very much. That was the perfect question I thought to ask. We are in the Swiss Pavilion. Switzerland has one pavilion, but we have so many cultures living in Switzerland. Yeah, and you had the perfect answer to that. Thank you very much, Magda.
Thank you.
Good. So I repeat for those online, we will now open the opportunity that you choose between the two. And don't worry, we know this is not a completely fair competition, less fair than what happened before, where the jury has judged just based on all the videos. We will have solutions to this problem, but please use the time, go online, follow the QR code that Ezra actually has prepared for us to do that, and I'm sure it will soon show up, and then you can choose. It's particularly for those who don't have time to stay also for the next part of our session, which will very soon start. So you can vote here. We will do the ceremony of the award after the next session. So we will have only one ceremony for both events, but for those online who cannot stay with us until 12 o'clock Dubai time, which is early morning in Switzerland, for example, we will have your votes anyway. Yeah, good. So you see now this Kahoot vote, you see a pin, and you have the QR code. If there are any questions online, I think there is a chat where you can ask, and you will have people helping you. Yeah. So the QR code has disappeared online as well? Okay. If anyone has still the need for the QR code, would it possibly show or not? It's finished, yes. That's perfect. Oh, you should not. You should not show the... Well, we will see. That's fine. Okay, so it's not on shown online. Okay, good. Very good. It's my pleasure to end the Science Flash Talk. It's wonderful that we had another one with a very special event here in Dubai, and I'm happy to hand over to Emily to run our second award-winning event. Emily, please.
Thank you very much, Nino, and thank you so much to Magda Gamba and to Ogona and Wanko, who did a fantastic, fantastic job. I think we can all agree. So congratulations to Magda. And now we take a look to the second part of the session, which is a scientific debate. Just so that those of you who are not aware how this came into being, we ran a Expo Dubai training program, which was specialized on communicating science in an easy to understand way. So to lay audiences, to the general public, something that's very important for today, to be able to communicate science to the world. A very important goal of ours within this framework of this Expo Dubai training program. We ran a course in which we trained students to be able to communicate their point of view from a scientific way, but also with passion and with good communication style. And that is what resulted in this scientific debate that you will witness today. And we have two speakers with us who join us live all the way from Switzerland, so that we will be showing their debate to us. The two debate students that we have are Ezra Valido. He's a PhD candidate from Swiss Paraplegic Research at the University of Lucerne, together with Ana Lucia Oña Macias, also a PhD candidate from the Swiss Paraplegic Research University of Lucerne. And they will be discussing, debating this morning or afternoon, healthcare should be provided for the elderly people at home, or healthcare should be provided for elderly people in institutions. So I'll hand it over to them, and you can make up your minds and see which debate you agree with or disagree with, and we will open the floor to be able to vote for your favorite debate. So without further ado, I'd love to have Anna and Ezra join us on stage now. Join me on stage so that you can take over. I will give you a microphone. Also to you.
Hello, good morning, everyone, especially to those in Switzerland, and happy to join online as well to the kids who would listen to our debate today. And I do think it's very timely that we think about this topic, this theme, because in 2019, 703 million people are age over 65. And that represents roughly around 9% of the total population, and we expect that to rise to roughly around 16% by 2050. The pandemic has challenged our healthcare systems at the moment, and we all know that the elderly population has suffered as well. So we ask ourselves, me and Anna, as students at the University of Lucerne and the Swiss Paraplegic Research, where we study disability a lot, should healthcare to the elderly be given at home or at institutions? And I propose that we do it at home. For the reasons that, one, we need to be able to tailor fit individualized healthcare system that maximizes our healthcare system. Second, research have really shown that those who are close to our elderly, when your provider is closer to your patient or to your elderly individual, they actually have better health outcomes. And third, which I go for more of a video or a movie that I watch, which defines what family is. And I do think in this day and age, family needs to be strengthened. So we ask ourselves, what does family means? Family means no one gets left behind. But how come when we put our elderly population into institutions, they're left away into institutions where you do not have daily contact to your family? And I do think that we lose a lot of intergenerational knowledge when our elderly population are not with us. So let me just elaborate on the first part. Tailor fitting your healthcare services to their individual needs really put patients in the center. And second, when you provide individuals who are familiar with them, they are given better care. So those two things actually benefit them more rather than putting them on a generalized, standardized healthcare services in institutions.
Thank you so much. Good morning, everyone. As Ezra just mentioned, he agree with the healthcare of our elderly at home, but I will argue that our elderly must be taken care at institutions. Why? He just mentioned the first point, that was that you need to give personalized healthcare. Do we know what is personalized healthcare? This could be very expensive, and is what they want, what they need, or what do we think that they need? A lot of questions that we need to think about in that way. Second, that means that all the homes have the possibilities to take care of them at home. That's not true for everyone. Now, the society has been changing a lot, and not everyone has a family to take care of them. And also that represents that they need time and money. So institutions can be a solution for that, to everyone have this opportunity. Another reason that he mentioned, that is like you need to keep the family dynamic. But going to an institution should not change that. I'm just asking you, how many times do you visit your parents now? Do they live with you? You and me are living in a different country. Do we visit our parents? This is a challenge that we need to think about. What is happening in the future with this globalization and all these challenges? We need to define and think other places, and especially the role of the woman. In a lot of countries, it's the woman who is taking care, not only the children, but also our elderly. And now we are working more, and this needs to think about. And the last point, you mentioned that they can be together in the same place. If you go to an institution, it doesn't mean that you abandon your family there. An institution is not only to take care of you. They can provide you rehabilitation, the basic healthcare, and specialized healthcare. And you can be with people from your age involved in more activities that is also very healthy, that be sometimes alone at home, just in one bed.
And yeah, Anna has good points. And she raised the issues on the costs, raised the issues on the burden on the family, and raised the issues that people might not have families to take care of them, right? Those are good points, and I'm not arguing that we abolish institutions. What I'm arguing actually is to put the main policy of our elderly healthcare services to really pinpoint, to be more centered to the individual, because the individual has different needs. You cannot put them all in institutions if they choose to be at home. And the family institutions, the opportunity lost of interactions of your children to their grandparents, that is not measured. But that I do think is very important, because a lot of the things that we consider culture, tradition, and the views of our past is reflected on our grandmothers and grandparents. And that is of value economically in the future and also of now. And second, on the idea that everybody will not have a family, right? But the thing is, the majority of our elderly populations have functional families. Why not maximize the resource that's already there, right? And that actually saves money. And second, you strengthen the family institution. And that is far more important, I do think. When we see ourselves more connected to the individuals in our family, then we become more comfortable in our own struggles in our health. And that's why I argue that healthcare should, in itself, should be prioritized at the center to individuals looking at society where you have actually strengthened family institutions.
Your points are good. However, I really consider that the institutions can be a solution, and we need to think about that. It's not nowadays the problem. It's the problem for you, for me, and for everyone here. And for example, in some cultures, like in Philippines, on Ecuador, yeah, it's true that you live very close to your family. But what is the reality in other countries like Europe? People really live alone. So, and we need to think that alone at home is a solution. Or if you are living there alone for several years, then you need to come back to your to the home of your children, or not children, but your daughters, your sons. That could change a lot because now the society is changing. So my point is that the government and the society must to think about that. Give the institutions the opportunity to develop the healthcare for our elderly. And the institutions must not be thinking only from one session. You can do more activities, for example, using the functionality that the people already have to create more business inside. But the important thing is that they interact with people in the same conditions. And also, if they need individualized healthcare, you have there people who already know about that. But what's happening now? We have different comorbidities, and do you know how to take care of your children? Of course, you are a medical doctor. But for the others that we didn't study medicine, do we know how to live with these comorbidities? How to help our parents? How you are going to feel at home if you cannot save them, if they have a problem? It's better to think in an institution that someone who really knows this can take care about them.
So complexities in taking care of our elderly population actually exists. But the main challenge really is how do we actually formulate our policies that enables this population, which is us, which is the future at 2050 would be that population. How would we want to be taken care of is a challenging question that needs to be answered now, posed in discussions now, so that we can actually benefit in that change in the health system. And with that, we thank you. I'm Ezra.
And I just want to finish that regardless the place where you live, and regardless our income, everyone deserves a healthy life. Thank you so much.
Thank you, Ezra. Thank you, Anna. Perhaps I can invite you to stay on the stage because I'm sure we'll be having lots of feedback and questions to you. And we're happy that we have this time now for questions and answers to them. Thank you so much. I mean, for those of you, now you see this wonderful debate take place in front of you. I have had the privilege to see the behind the scenes, to see the effort that they've put in terms of the workshops that took place, and also in terms of the one-on-one training and the coaching that they received. And this is really the fruit of all the work, the very hard work that they've done. So once again, congratulations to both of you. No matter who wins the debate, you are both winners already to be here and after all of this training. So very well done. Do we have any questions from the audience to Ezra or to Anna about this interesting topic before? Yes?
Thank you, Anna and Ezra, for this interesting debate. But it's not necessarily a question about the topic. It's just that I would like to know which argument of your counterpart did you like most and why?
So perhaps, can I start with, can I start with you then, Anna?
Yeah, thank you so much. We have been working a lot, and in this sense, in both sides, because for a debate, you really know the arguments from the other side. And I really like the sense that our elderly is part of the family. Because what happened is that sometimes we forget when you start a new family, you get married, you just start something new, but you forget what happened to you, who took care of you when you just start, who give you the whole opportunities to now have a family. So I think that that's the argument that I most like about Ezra's opinion, because that's what my parents, my grandparents means to me, part of my family.
So for me, I have to So the first one I do think, because my background is I'm a medical doctor, so I tend to see patients as individuals, and that's why I argue for always tailor-fitting services to the individual and then span out and what society can support, and that would always be me. But what I really like about Anna's argument is on the economics, but because healthcare has cost. And as a person who does also administration in health services, you need to really take that into account, because you might provide the best ones, but it also costs. But if you lack the funds, then you need to settle for things that are priority. And more importantly, I do think, as Anna also stated, is the role of women in that in that cost. The burden that I came from the Philippines, and I do think it's also the same in Latin America, where the women, or the youngest women are the ones who are burdened in taking care of their parents or their grandmothers or their grandparents. And is that fair? Is that a gender equal society that we're promoting? I do think solutions to that, I do not think that we can change it at the moment, but something to think about is that, because we see it as normal, and it's normalized in some of our societies. And I do think Anna challenges that. Should women be the only one be taking care of our elderly population? Or should men also take part? Or should government also support men who will support their families?
Well, thank you very much for this very interesting debate. Of course, as you would agree, the two approaches, they both exist and they will continue to exist in many countries. Could you just let us know, how would you go scientifically to address this question? I mean, how would you figure out what is the better solution, under what conditions, etc.? How would you set up the science to answer the question that hangs here around in this debate?
For me, the more important thing is very much contextualized by your own epidemiology in a country, and given into consideration the contextualization of your own culture. Because, say example, for the Philippines, our demographics is very young. So in a way, the economy would grow to support a bigger and bigger population of the elderly. So in a scientific way, I could argue that in the near future, maybe in the immediate 10 years, we can actually afford, by just the status quo, improving services and improving more. But looking at it at 40 years to 50 years from now, that demographic will change, especially now that they're also into reproductive health. So they're actually, not limiting, but promoting to control the number of children. So once you have that reduction of the number of children, we might also have what we see in other countries, where you have a higher median age and lower economic output, to which the economy would be strained by the services needed for the elderly. So scientifically, I would go for the epidemiology of this, but also taking consideration a lot of the qualitative needs. Say in the Philippines, it's very strong, it's very devout Catholic, and your parents are the core of your family. So it needs to also put that into mind. One of the things that I find as a solution before was, in some countries, and even the Philippines before, they actually give tax benefits for having 4 children, and then they reduce it to 2. Why can't we actually get tax benefit as well when you take care of your parents?
Thank you so much for your question. It's very interesting to put the scientific point of view here. But in my case, come directly to my mind first the culture and the income of the country. Because we can have plans, very nice ideas, but you really need to realize the reality of each country, not only from the epidemiologic point of view, but also the things that are priorities in that country. For example, in Ecuador, if you want to change now, put someone in an institution, it's not going to work. My mother, my aunts, they will feel very guilty doing that. So it's a very controversial topic that we cannot change from now to the future. So I think that first we need to normalize and plan what do we want. And second, we start with education. Because now it's changing a lot, and if you don't face this together with the education from the scientific point of view, not sharing fake news or the ideas that you want. From the scientific point of view, what is the best solution of the best approach? And could be not only institutions of a home, could be maybe a community service that take care of people, because as not everyone now is married, so you could not have like the traditional family. So could be people that really are single and know how to do the work and really can be involved in the daily day in different houses, helping people, helping the community. So it's something that I cannot be say like directly scientific work in this area. They need to work together with the community, understanding, because otherwise we're having a lot of papers, a lot of research, but no results. And this must to be combined with the policies, because if the government doesn't support this, we are not going to go anywhere.
Hello, my name is Dante. As well, I introduced the session, so I'm sure you know my name. I have a question regarding the collection of data. As you know, some countries, we have a phenomenon where the elderly are abandoned in homes, and the respect for the elderly is perhaps lacking in some cases. On the other hand, we have some countries, in Mozambique, for example, where the elderly are a pillar of the family life, and they often take care of kids and after school, for example. So, collecting the data, how, geographically speaking, how do you manage collecting data from various geographies? Do you have to A, focus on a specific country, or B, if you're combining data from, let's say, Mozambique and France, or Italy, or any other country, how do you differentiate? How do you take it into account, this qualitative significant difference between the countries? Thank you.
Well, if I look at it in more data presentation and data analytics kind of way, and knowing as well that there is strong context on how policies and health systems are structured for each country, I would rather do that they're stratified on the country level to which they belong, for reasons that policies are generated and at each of the countries anyway, and we do not want to promote or to curtail sovereignty of these countries to how they actually benefit or how they should structure the health system. But the thing is, we can also get teams, like a lot of the Asian countries and even the lower middle income countries really does have family-centric health system or family-centric of healthcare providers. And then you have the Western, the more North American and the richer countries who are more independent and who has more of these institutions that support their population. One good thing I do think is we can learn from each other. Some countries like Thailand has a very high median age, but still would be considered an upper middle income. They don't have enough of the budget or the health capacity to actually provide for the impending larger proportions of elderly population. And I do think they can learn from the higher middle income countries, such as those in Europe, on how to best way do it. And in the Philippines, we actually look ahead and we're looking at these countries on how they do it. So it's not, in the academia, we don't want to copy just because it's intellectual property. But in management, you'd want to copy good practices because you don't want to learn it. You don't want to fail the first time because others have been ahead of you. So you'd want to copy those things that could be adapted to your country.
The data collection is a challenge everywhere. And it's important to have a balance, because if you just have the macro information, you are losing the cultural aspects that you can very learn. For example, Switzerland is a small country, but had different cantons, and each canton is a whole country. So you really need to know and have data of each detail. So it's from one side. But from another side, if you don't compare the country with other countries, you cannot know what's happening. You cannot know in which level are you. So I think that you need to have a big umbrella, because if you don't standardize and you don't give the lines to the countries how to do it, really you cannot do research. Every country is going to have in different language, in different ways, but at the same time, you need to give them the option to learn and to do the things by themselves in the country per se, because every country has their own history, they have a lot of things to learn from themselves, but you need to have the balance, but it's a challenge.
Maybe could I invite you just to say a quick word about, as you know, a big part of the training was also to reflect on the Swiss perspective always, and that's our goal here as well, not only to have this global perspective, to also have a Swiss perspective on this issue that you've raised, very important topic. As you also know, we have a large elderly population in Switzerland. What can we learn from Switzerland when it comes to caring for our elderly population? Can you say a word on this?
I live in Lucerne behind an institution for the elderly, and what I like about walking through there most of the times is, and that's right, a lot of them actually engage with the same age that they are. And I do hope that they have chosen that. But in Switzerland, I'm almost assured that they have chosen that. And that is a normalized thing of it, the degree of independence that you give to individuals. And that is something that I admire. And second, the facilities are really great. And every Christmas, which I spend my Christmas because I can't go home to the Philippines, I've also seen that they actually get visited. And it becomes a festive place when it becomes the season for meeting people. And this is something that I do think, that's why we always go back to context. Because in Switzerland, this is something that is normal. This is something that is promoted to be independent and to be able not to be a burden to others. And that's very, very strong. And that I do think I admire, because in a lot of countries, as you go richer, sometimes you get more of that mentality of being independent, of having to survive as much as possible on your own. And for me, that is actually very much. And the research also in Switzerland goes that the closeness to the provider may not necessarily be family. It's actually the closeness of those who provide it in the institutions, because that can also be developed. And that is actually a challenge for the health workers who provide services in this institution, to get to know these elderly people, because they have personalities. They are individuals. They're not just sick. They're actually just living a life. And because we have this technology that prolongs our life, we want a quality of life that functions, that they not just merely breathing, but actually living.
I think that in my case, I live also in a hospital close to the early institution, but Switzerland has a very perspective of the future. So in Ecuador and a lot of countries, first of all, if you don't get a job if you are in your 30s or 40s because you are too old, and you have this perception normalized. But in Switzerland, you are not old at all, so you have really a good healthy life. So I feel so guilty when I go to do some exercise and people older than me are very fit, and I like, okay, I can do it, but no. So my main point is that they think in the future, not like today you need to live as is the last day of our life. That happens in a lot of countries, but for different reasons. But the other thing is that you really respect and plan what's happening, and you respect a lot the people, the individual decisions, and how you live in a community. Because in some countries, it's my freedom and my decision, but working and living in a community needs to have a lot of respect for yourself and for the others.
Thank you. Thank you very, very much to Ezra and Anna. I especially liked the question that Magda gave, which was to ask them to think about what the argument that they enjoyed the most from each other's argument, which is excellent, because actually this was a very big part of the training that they received, to be able to have an insight not only into their own perspective, but into the perspective of the other argument, and also that they were able to close with a bit of a a learning note, a key message from Switzerland, something that they found important with respect to this topic from Switzerland. Thank you so much. So now, for those online and for those here, we do have the possibility to again cast the vote electronically. If you scan the QR code that is up on the screen, you can vote now for the debate that you agreed the most with, or the side of the argument that you liked the most. So this voting system is open as of now. You don't see.
Maybe you are me. No.
So fantastic. Congratulations to you both for this whole experience, for the debate. Thank you for presenting it to us once again live. So not only did you have to do all the training and the videos that you did and go through all of that process, but you won the chance to come here. And again, you're both excellent and both winners here. And I now invite Professor Nino Künzli to come up and to announce the winners and to close our session for today. Thank you.
Thanks a lot, Emily. It's my big pleasure to end this ceremony with announcement of the awards and the winnings. Some have already seen it. You see, we have some technical issues. Usually we don't actually show the exact number of votes. We just announce who is winning. Well, in the Science Flash Talk, we had, of course, this unequal way of showing up. And so we had some race, and in this case, Magda had the advantage of being here, and so she had higher scores than Ogonna. But of course, you were both excellent, and if you look at the videos, I agree with the jury that they had trouble to decide which one was better. So I would like to congratulate both of you, and I will announce the award you will get at the end, because we will move to the next debate award. But maybe just a big thank you and an applause to Magda. And now for online, applauding Ogonna. Your video was fantastic. Thank you very much. So before talking now about the two other winners, it's fascinating to see 3 of the 4 who did compete today are actually recipients of a Global P3HS Fellowship of the Swiss School of Public Health. And I just want to emphasize that because the European Union, at the time we were still eligible to get money from the European Union, which unfortunately has changed. But we were competing for a grant to get co-funding from the European Union to bring 50 PhD students from all over the world to Switzerland. And that was absolutely fantastic. And what I do know from all the institutes, they are thrilled by the students we brought from all over the world. So as you have seen from all those who did compete, 3 of the 4 actually are fellowship holders, and this is wonderful. And of course we will also report that to the European Union of the success we have with this program. So I'm very, very happy this turned out the way it was. And you have all seen these are brilliant students, all of them in fact. So yes, 2 of them were competing in a debate, which was fascinating. You did perfectly. And actually, Emily, I would like to thank you. You have managed all that training. This was spectacular. And this question at the end, to compare it with the Swiss perspective, I learned a lot from what you see from outside, how we do things in Switzerland. It's fascinating. So thank you very much for doing a great job. Well, you have, or some have seen, there was some tight race. I think I saw it correctly that Anna was scoring a little bit higher than Ezra. Is that right? Yeah, I didn't mess up. So both of you, a big applaud. Anna had higher scores and Ezra did very well as well. Yeah. So you wonder how we do that with the award and the prize and how we can manage that. Well, of course, all of you, the 4, including Ogona, you should get the same prize. And we have decided actually to give all of you an opportunity which will expire. So the Swiss School of Public Health, as you may know, and many might know also those online, we are the owner of 2 journals, of the International Journal of Public Health and of the Public Health Reviews. These are both scientific journals, and they're both published by Frontiers, this highly innovative company you have seen, Lausanne-based company. We had this wonderful event last night. They are publishing our journals. And all of you will get the opportunity to publish a first author paper in one of these 2 journals for free, because as you know, open access comes with a price. We will pay your fee, but the condition, the expiration is that this will only work if you submit in 2022. Yeah. You can choose the journal, and we will write down the names. I know that Sandra Nocera, our director of the office in Zurich of the Swiss School of Public Health, she is online. She has taken notes about this decision, last minute decision. As you see, we do many decisions late these days. So please take this opportunity, and we will be very happy to see your papers. Of course, we cannot promise you that it gets published. It's a peer review, you know that. It goes through the normal process, but if it's get accepted, you will get a free waiver for this APC fees. Yeah. So thank you very much. And we were saying we end this wonderful session with photo shooting. And for those online, thank you for having been with us. Of course, you can still look how we do the pictures. And for the others who are here in the room, thank you very much for being with us. Enjoy the lunch break, and we will continue in this afternoon. Thank you. Thank you.